Welcome to NCSS Here for You. For over 50 years, Northwestern Counseling and Support Services has been providing access to quality psychosocial services to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously, and we strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show. I'm Joe Halko, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a human services topic, and we do that with staff from one of our 3 service divisions. Our 3 service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And, on occasion, we have guests from organizations that NCSS collaborates with throughout the year. This month's episode is titled Wellness Recovery Action Plan. The Wellness Recovery Action Plan is also known as WRAP. WRAP is a multifaceted system designed to help people maintain wellness and stability. At its core is the premise that individuals have choices and they can maintain and have a lead role in decision-making around their health care. It also hinges on sharing experiences and strategies with others who have similar struggles. Initially designed to help people with mental health issues, WRAP has shown success in numerous different areas. It is an evidence-based practice that's utilized worldwide. To discuss WRAP in greater detail, I'm pleased to introduce this month's guests. They're Gladys Barnes, Mobile Outreach Service Coordinator, and Jessica Palmer, Residential Program Service Coordinator. Both Gladys and Jessica work in the Behavioral Health Services Division at NCSS. I'd like to welcome both of you to the program this month.
Thank you.
Thank you.
So to begin with, what does WRAP stand for again?
Well, Joe, WRAP stands for a Wellness Recovery Action Plan, and it's an individual plan that people create for themselves.
And can you give a basic explanation of WRAP before we go into more detail?
Sure. So for WRAP, each week is building on the previous week. So at the end, you end up with a complete plan. The first thing that you're going to do in WRAP is build your wellness toolbox. So you're going to identify any possible tool that you could use for a variety of situations and compile them all in one place. And then you're going to go back to that throughout the group to pull out different tools for different moments that you're experiencing. The next section is building a daily maintenance plan, which means first identifying what am I like when I'm doing well, so that I know that and other people know as well. And then I'm going to make a very bare bones, concise list of what are the things that I need to do every day to stay at my baseline. So it's a short list, just kind of this is what I have to do each day to stay well. From there, I'm going to make a triggers plan and identify what my triggers are, and then go back to that toolbox and pull out what do I need to do here to respond to my trigger. Then we're going to do the same thing for early warning signs. What are my early warning signs? And then how am I going to cope with them when things are breaking down, and how am I going to respond to that? And we're going to finish with building a really strong crisis plan. What does a crisis plan look like for me? How am I going to respond? What do I want other people to do? What do I want other people not to do? And then finishing with the post-crisis plan of how am I going to get back, and I'm still kind of in a vulnerable place, how am I going to get back to my wellness and make sure that I don't slip back?
Mm-hmm. And how was WRAP developed and created?
So WRAP was created and developed in 1977 when a dozen individuals who had experienced serious mental illnesses came together in northern Vermont for an 8-day gathering. It was designed to initiate dialogues about how to improve their emotional and their mental health. Mm-hmm. During this, many things came out of it. And this is where Mary Ellen Copeland decided that she would develop and distribute a
kind of the formalized RAP plan.
Yeah, and she created her recovery books, and
it's used worldwide now. It started off, it's really cool. It started off right here in Vermont and is now used all across America, but also all over the world. And it really started from Mary Ellen coming to a place in her life where she was no longer able to take medications and asked her doctor, well, what am I going to do if I can't take meds? And he didn't have an answer for her. So she reached out to other people in the same situation and said, what do you do if you can't take your medications or in addition to that? And she found that other people were really feeling that same lack that she had felt, that they wanted more, that they wanted to supplement their medications if they were taking them, and didn't feel like there was a lot out there. So that was how she ended up sort of hosting those first workshops and then formalizing it into the RAP that we use today.
What's interesting is you say Vermont, so I'm sure there's a lot of people when they see that this is a global program that's used throughout the world, that it actually began right here in Vermont.
Yeah, it's really cool.
And it's actually evidence-based, which is nice that Vermont has that history.
And if you could explain to the viewers, because they may hear the term evidence-based, but they may say, well, okay, but what does that really mean? What would that mean to someone who might be thinking about getting involved in a RAP program?
So evidence-based is something that's been tested throughout various states. It's actually been tested in Illinois and Ohio. It also has been tested by researching, how much it impacts a person's life and how they're able to go on and do the things that they want to do based on the plan that they've created. It's interesting that Ohio has actually done an extensive amount of testing on this, and their evidence has shown that it's impacting people's lives and making them better, and that the people are actually in charge of what they're doing with their lives, probably for the first time for some people.
Yeah, so we have this quantitative data that shows if you go to a RAP group and you build a plan and you use your plan, I'm going to be better afterwards than I was before, measurably better, and that's really powerful.
The other thing that you're saying is, even though it is a group of individuals, is that to make it successful for an individual, it's very individualized to them and their goals.
Absolutely.
I tell people it's a lot like putting a puzzle together. You have all the pieces, you just might not know how they all go together. So when you come to a RAP class or a group, it's a chance for you to take the pieces that you have and put them where they need to go, but you're doing that also while you're talking with others about things, because they may actually have another piece that works for you that you haven't gotten in your puzzle yet.
Now, how is it different from other programs? What makes it different?
I think the keystone to that is that RAP was developed by peers. A peer is someone who is struggling with their own mental health as part of that community. So it's developed by peers for peers. And there's lots of other really powerful, really useful programs out there, but I think sometimes it feels, it doesn't feel good to have other people saying, do this and you'll feel better, or do that and you'll feel better. And that RAP is really empowering because I'm deciding for myself, this is what I am going to do. And I think that it's just about, taking back that control of your life. And I think another big part of it is just sort of the group discussion, that everyone is there on equal footing and you're listening to other people's experiences and what other people have done or tried. And then you're sort of in this place where there's a ton of information of lived experiences, and you're able to kind of pull from that and say, okay, so I've experienced something similar. This is what I'm going to try. You did that. I'm going to try that here. So it's not about other people telling you, do this and you'll be better. It's me deciding for myself.
And how long has NCSS been offering a RAP program?
So NCSS has been offering RAP for more than 5 years. It's something that's done pretty much annually, but it can vary from time to time.
We usually have groups kind of ongoing at multiple points during the year, and I think the fact that we've been doing it a long time really speaks to the fact that it's not a fad. It is something with staying power. It started in the 70s, and people have been using it consistently since then, and people keep going back to it and keep using it because it's useful, because they feel a difference after using it.
And speaking of using it, some examples of what do people use it for, and who uses RAP?
Sure. So you touched on this in your intro, Joe, that originally RAP was created by members of the peer community, people trying to figure out how to better cope with their mental health. But because it's such an individualized plan, you can really use WRAP for so many different things. It's so personalized. It's for what I'm experiencing right now. So people now use WRAP for quitting smoking, for losing weight. People develop WRAP plans to cope with a chronic illness or to cope with a specific injury. And I mean, people build WRAP plans even just to sort of do better on a day-to-day basis. Mm-hmm. So as facilitators, we are required to develop WRAP plans and use them too. So I think it is really cool to use it yourself and see, oh, you know, this is how I can make sure I am ready to get out the door in the morning, you know?
Mm-hmm. And how do you know that it works?
Well, like we were saying earlier, WRAP is evidence-based. The WRAP model was designed by Mary Ellen Copeland and implemented by properly trained facilitators such as ourselves. And it's been rigorously studied by researchers who have respected their mental health research. The University of Illinois in Chicago has proof that WRAP has been helping people to experience greater levels of wellness and to move forward with their recovery. If this is something that you'd like to learn more about, you can actually look it up on the National Registry of Evidence-Based Practices, and there's actually some data there for WRAP.
And what's the environment of a WRAP group?
Yeah, I think that's another way that WRAP groups can be kind of different than other groups. As facilitators, Gladys and I are helping shape the conversation, and we're presenting the structure of WRAP and sometimes helping focus the conversation on what we're talking about in that moment, but we aren't teaching anything. You know, we are facilitating a conversation and allowing a conversation to take place, and we are equal learners there. Everyone there is on an equal footing, and I think that makes it different, and also is just a really kind of powerful thing. I think that it's a place where people feel comfortable sharing personal information or even just sitting and listening, but it's a place where people are getting a lot of information and are feeling like, you know, maybe I can do this again. I've been feeling really hopeless, and maybe I'm seeing other people here talking about I can do this, you know, and focusing on what am I going to do, you know, on making a plan. And so you're not feeling hopeless because you're developing A, B, C. Here's what I'm going to experience, and here's what I'm going to do. So it's really powerful to be in that room and experience that together.
And how and where is WRAP provided?
We have groups throughout the year. We provide it in a variety of ways. So we have groups that are held at Northwestern Counseling and Support Services at a couple of our different locations. We also have groups that are available to community members that are held in various places in the community, and those change. We are holding a group currently at the hospital here in St. Albans. We've held groups in Richford. So if people are interested, I would say get in touch with just kind of the main line of the agency, and we can let you know when the next WRAP group is going to be. But they tend to vary a little bit in time. We've done one-day groups. We've done groups between 6 or 8 weeks that are 3 or 4 hours, kind of depending on how long the group is meeting. So it varies, and we try and adjust it to meet the needs of the people who are interested in attending as well.
And Jessica, you mentioned if they're interested to call, can you
Yeah.
give them the number to call?
Sure. I would call the main line of the agency, so 393-6555.
Okay.
Or 524-6555. There we go.
524,
Yeah,
yeah.
excuse me.
That's okay. Now, since both of you have been facilitators, how long have you been involved with WRAP?
I've been involved with WRAP for 2 years. I have facilitated 3 groups. I also facilitate WRAP individually with people who I meet through our crisis services at NCSS, which is nice to be able to kind of meet them in crisis and watch them develop and change as an individual into where they want to be in life. So I've enjoyed WRAP, and I really like facilitating it, watching the people come back and say, you know, this really works and this is awesome, and I can't believe I knew all this stuff and I wasn't using it. That's what I kind of like about WRAP.
Jessica?
I've been doing WRAP for about 3 years within our CRT program and also in the community. And I think it's just really neat to see people feel better leaving WRAP than they do coming in.
Now, you know, as with anything, at the end of the day, the individual has to want to make the changes and what have you. What is it that you feel that WRAP is able to do to maybe get somebody who's tried a myriad of different things over the years and just never been able to get over roadblocks that makes this a success for them? I mean, are there some things that you can point to that you feel this offers that maybe other types of programs haven't to make people successful? Because I think, Gladys, you had mentioned that a lot of times people will sit back and say, geez, you know, I kind of knew all these things, but for whatever reason, I didn't quite know how to structure it and make it work for me.
I think the RAP, when we're doing the classes, it allows people the time to see that they have all the skills, they're there. They're just not accessing them when they need to be accessing them. So it puts it in a plan so that they can. It also allows for them to be in charge of their life, to have a voice and to be able to say, this works for me, and I know that it works for me because I can measure if it's working or not working. And I think that's probably for the first time that people are able to do that.
Yeah, I think it feels very attainable. It's simple, you know, they're not asking questions that you can't answer. So you feel like, okay, yes, I can do that. And you're seeing other people doing it. You know, you're watching other people have success, and it makes you feel like, okay, I can do this too. And I think Gladys is right. It's all about things that you already know and things that you're probably already doing informally and just putting it in this formal structure. And we are doing other things too, you know, doing guided meditations and teaching maybe some new therapeutic skills. But the focus is, you know, what are things that I already know how to do, or other things that people here from their lived experience have done. So it just feels very doable.
Now, do you ever find that, you know, somebody comes through the program and that because they've had success, that maybe other family members might also want to get involved? I don't know whether that has ever occurred or not, or if that's part of the puzzle, but
Sure, definitely. I think people have done it and then hooked up, you know, a sibling or a parent. I think people will tell their friends about it too, you know, and say, oh, this is a really good program and you should do that. And, you know, and I think that's how we get some really strong participants is you're hearing from other people, oh, I really liked that.
And some people will want to take it a second time because they have such a good experience with it. They'll also bring a friend. The best part of RAP is the support that's built during the groups. People can meet other people in the community. They're able to gain strength from that because they actually have a conversation with someone about where they're at and where they want to go. And so they're able to gain the support and keep going with that support even when RAP is done. It's not like you just come and you learn these things and you just move on. You're getting to know other community members who have the same interest as you.
And what would you say, what would be the youngest age that you would say would be appropriate for somebody to be engaged in this process? Is there kind of a...
You can do RAP at any age, and there's definitely RAP that is formulated particularly for children. I think that the people that Gladys and I are supporting are all adults, but you could use RAP at any age, and if you were interested, you could get materials, you know, directly from their website on how to use RAP with kids.
Now, are there any real successes that you feel really, I mean, I know every success is individual and it's all good stuff, but are there any types of successes that you have seen for yourself that are just amazing to see transformations? And if so, what types of things took place? I mean, I'm not trying to be...
No, I think that's a great question. And I think the success sometimes is a small thing. You know, sometimes it's people saying, okay, you know, I really struggle with procrastinating and feeling overwhelmed, and how am I going to cope with things better? And sometimes it can be something really small. I think that sometimes a RAP plan can help tap into those keystone habits where if you make one change around something big in your life, it really spreads out and starts affecting other things in your life. I think for me, the biggest thing that I see people walking away from is feeling empowered, you know, and just having that sense of confidence back. And it's easier to cope with the things that you're struggling with if you're feeling empowered and seeing other people feeling that way too.
I would say the biggest success that I can think of that I know has come from these RAP classes is seeing a member of the community who's attended RAP groups actually become a facilitator. That is just, to me, that's success.
Yeah.
Because this is a person who's, you know, attended the groups and is now facilitating them too, and that is the potential for RAP. You can do that. You can be one day, learning RAP, and the next day facilitating a group. It is there. It's just a matter of taking the classes and doing what you need to do. But it's a possibility.
Yeah, it's really great to have peer facilitators because it's someone really speaking from their own experience.
Sure. And you speak about the peer aspect and the fact that at its core, this all was born out of peers. Can you speak to the importance of the individual who's the receiver is that they're getting the message from somebody that they view to be a peer, as opposed to someone who may have, a degree and have book smarts and everything and really understand the program, but may not be viewed as a peer. And the importance to that individual that it is a peer that's helping them with.
I think it makes the message stronger, and I think that a peer offers a perspective that is sometimes forgotten, and they're able to bring it to the surface and say, I know that this works, and the genuineness that comes from that, you can't get from a book.
And Gladys and I as facilitators with our own RAP plans, try and access what do we use our RAP plans for? You know what I mean? Setting my alarm clock early enough that I have time to pack a lunch, and that makes the whole rest of my day go better. So even though Gladys and I aren't peers, we're still trying to access that aspect as well. But I think it's invaluable to have peer facilitators. And
another important thing you've mentioned is the fact that all struggles are not created equal. So somebody may have something that really is not a major roadblock, but for some reason it's what keeps them from being able to advance what they're trying to do. Or other people may have a lot of what you would deem to be major conflicts that they're trying to struggle with. So this gets back to the fact that it's individualized. And can you speak to, so that people don't feel they have to have major concerns before they get immersed in this program, that possibly it's something that would be deemed as it's small, but yet it just puts them into gridlock.
Yeah, I feel that way for myself having my own RAP plan, and it really it doesn't have to be I have major depression or I'm having panic attacks every day. It's certainly useful for those things, but you can really use it, and people do come to group doing pretty well, but wanting to get just a little bit better. Anyone without a mental health diagnosis can use it to do a little better. And how can I get along a little better, or how can I cope with day-to-day stressors that are inevitably going to come up, that we all experience.
My personal RAP plan was a weight loss one. How am I going to lose the weight? And so I put things into my daily plan, which the daily maintenance of, going to go to the gym every day. Well, everybody says I'm going to go to the gym every day, and we don't. So there were measures that I put into my plan to make sure that I went. For example, part of my plan, my sister, she calls and checks in with me. Are you doing what you need to do? That accountability keeps me on target so that I can complete my RAP and do the things that I want to do. And it does have success, so it's awesome.
I've helped people make RAP plans to quit smoking too, and I think that's another really useful tool, because quitting smoking is so hard, and you can feel really discouraged because it takes so many tries to be a successful quitter. But people have used that to just kind of to identify and know I'm going to have triggers that are going to make me want a cigarette. I'm going to want a cigarette when I have a cup of coffee or talk on the phone. And what am I going to? I'm going to make a specific list. Here's what I'm going to do when I want a cigarette. And you're just it's a little bit easier to quit when you have something very clearly identified. This is what I'll do in this situation.
Now, have you had situations where, because I know on a lot of these programs it's a series of maybe 6 sessions, something along those lines. Have you had situations where individuals have been working on their plan, moving along fine, and then maybe halfway through or what have you have hit a roadblock? And then if so, has it been easy to then get them to get back on track because of the way that the plan is written? Or
I feel like that happens almost every group, that there is somebody who in the middle of group has something, because stressful things happen to us all the time, who experiences something really stressful, and it's hard to want to go to a group sometimes if you're having a really bad day or a really bad week or something really big happens. But I think that people sometimes will take a week off and then come back, and it's sort of nice to get that extra support. You know, you have this extra structure in your life for 6 or 8 weeks, creating an additional structure that's going to last you however long you choose to use it. And I think that being in a space where other people are really open to talking about or just listening about, here's what I'm struggling with, you're getting all that extra support and caring, you know, when there's something that you're having a hard time with. So I think, you know, I think it happens a lot.
A RAP plan is created for those times when you are doing well and then things slip up and they're not going the way you want them to go. That's the whole point of having an action plan into it. That's where you can catch yourself before it gets to the point that you don't want it to be. It allows people to measure where things are at. It's probably one of the first tools that I've seen, other than an asthma action plan, that allows you to measure your breathing. A wellness recovery action plan allows you to measure how you are doing as a person, and it's the first one that I've seen like that.
Now, I know you had mentioned there's like this accountability within the group, because you know you show up and there are those that are also working on their plans, and you kind of talk amongst one another. Do some of the folks though feel that they have to have somebody else in their life that's not part of the group that needs to hold them accountable as well, or is that not part of the mix here with the plan?
It's absolutely part of the mix, because that's where your support comes from. Having that person there that you can talk to about how things are going for you. Having that person to say, you know, I don't think things are going well for you today. Maybe we should look at your plan. What are some things that we can change? Having that person who knows you and knows your plan is part of the wellness recovery action planning.
And I think we all do better with supporters. Sometimes it's hard in rural areas to connect with people because we're, by the nature of where we live, a little bit cut off. And so I think RAP is about finding supporters within the group as well. But I think also it's sort of up to you, because every plan is personalized. And sometimes people aren't comfortable identifying, you know, someone to prompt them to use their plan. So it's really, what are you choosing to work into your plan? Do you want people to help you with certain times, and with what? And you can choose to set limits too. I want someone to help me with this, but not that. And that's kind of the power of RAP, is you're deciding that for yourself.
And you make a good point about a rural area which we live in, but I think it's also important that people understand that anyone within Franklin and Grand Isle County can take advantage of this program through NCSS.
Absolutely.
Okay, well, it's hard to believe, but our time this month is up already. So I want to thank my guests, Gladys Barnes and Jessica Palmer, for being on the show today and sharing their insights on the benefits of the Wellness Recovery Action Plan. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halko, and I'll be back next month with another episode of NCSS Here for You. This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. For over 50 years, Northwestern Counseling and Support Services has been providing access to quality psychosocial services to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.